I have a couple questions.
Yeah, okay.
Going back to ACT UP.
Sure.
You mentioned the pressure ACT UP put on Seattle King County Public Health to initiate a needle exchange
Right.
program. But
To take it over, right?
more generally, what was the relationship between ACT UP and Seattle King County Public Health during those years?
I guess enough um, time has passed that it's okay to talk candidly about some of this. So Bob Wood, Dr. Bob Wood, who was in the health department and was appointed to be head of its HIV/AIDS programs, was a gay man who had HIV. I think it's publicly known for a long time that Bob had HIV. Now, there were times that we had to, what shall I say, oppose Bob in certain things, yell and scream about him. Sometimes because we didn't think he was seeing things the way we felt they should be seen. Sometimes, like with the needle exchange, he was very supportive of the needle exchange, was to create a situation where he might, in fact, internally in the health department have more room, by going to his superiors and claiming, these people are carrying on about me, this is not tolerable any longer, we have to do something and so forth. But just the way that we attacked the head of the Northwest AIDS Foundation because it was moving too slowly, it was being too compromising, and yet when the executive director left, who we had trashed up and down, she sent me a personal note thanking me for what I had done to keep her, moving forward. I mean, I think it is a very sophisticated stuff. You can get, the anger can be real, the feeling of, you need to attack can be very real, but there's no doubt that unless you're totally insensitive in the long run, you understand people are playing certain social roles. And one of the social roles of an organization like ACT UP is to put pressure on institutions like the Northwest AIDS Foundation, like the health department, even if they're doing good things. Because from donors, from the hospitals, it's like another example. Bailey Boucher, and I talked to you about how we had gotten Bailey Boucher, the logjam, eliminated. There's nothing in the official materials except until recently an actual interview with me. There's nothing that Bailey Boucher's materials have that talks about this problem in the establishment of the House. Okay? Why? Because it's now part of a major hospital system. People in these positions of powers, hospital boards, community hospital boards, this is Virginia Mason and so forth, they apparently don't want to acknowledge the fact that street people and people agitating publicly get things done because their whole worldview and the way these organizations operate is all hierarchical and top down, and someone from the board of the hospital knows someone in the health department or someone, and that's the way things are, quote, supposed to get done, not with screaming radicals in the street. So the actual history of how Bailey Boucher came to be expunged. The whole thing about Cal Knutson blocking it and ACT UP getting Cal Knutson to drop the case and all of that, until finally they were doing an oral history project, and I contacted the current executive director and I said, this is intolerable, and so they did an interview with me, and on their website at one point they published 2 or 3 Q&As from the oral history that indicated some of this. So yeah, we had to, even an organization that we supported like Bailey Boucher, eventually you have to take an, I don't want to say adversarial position, but you have to pressure them, okay? And I understand completely. They're now an arm of Virginia Mason, and they have to report to that board of directors and all that whole bureaucracy and everything. So groups are concerned about donors. They're concerned about respectability. One of the great things about an organization like ACT UP is that it said, we're not going to be respectable, but you're going to have to take us into account anyway. And that was, now I started to talk, and I didn't finish this up, I want to say this. ACT UP nationally changed the whole way that the FDA deals with drugs. And this is like one of the most incredible achievements of ACT UP. First of all, it plugged into the whole burgeoning patients' right movement at the time. Patients taking control over their own medical needs and the like, vis-a-vis their doctors, but also vis-a-vis the FDA. So you had all of these situations of people trying experimental drugs that the FDA wouldn't release, and including some great daring-do people who went to China and smuggled out this compound Q that one of the hospitals there was investigating and brought it over. I mean, people did, and ACT UP did, not at ACT UP Seattle, but ACT UP generally across the country, absolutely unbelievable things. So getting the FDA to do, quote, compassionate release of drugs that have not been officially approved but look like they might help, but allowing people who are in danger of dying to make the decision for themselves that they were going to try this experimental drug rather than not, which is a tremendous change in the way the whole FDA operated. Those notions are largely due to ACT UP, speeding through drug trials, all the rest of this kind of stuff. So that's not the local health department, that's the larger health establishment and so forth. ACT UP made significant changes, which people with cancer, people with other diseases are all benefiting from, which is the way it should be, that we each benefit from each other. As my mother, may she rest in peace, used to say, each hand washes the other. And that's the connection between what gay activism has to do, and activists have to do, with other communities and other concerns of other activism, is you have to wash each other's hands. You have to help each other in those kinds of ways. Other people had done stuff and did stuff around FDA that benefited people with AIDS, and what ACT UP did with this whole notion of compassionate release and speedy drug trials, I think really was a major achievement.